All right, so previously what you should have already done is answer the questions for this introduction section. So what is your daily level of physical and sport activity? So if you play a sport and you go to practice, maybe you practice your sport every single day for, 2-hour practice, I don't know. If you're on your own, maybe you go to the gym for an hour, maybe you take a walk for 30 minutes, maybe you go for a run. That's up to you. Do you often become winded after climbing a set of stairs or running short distances? That's like a yes or no question. So you get to decide. How long does it take for you to recover? So after you run a short distance or climb a set of stairs, are you panting at the top of the stairs for like a minute, or are you just good to go once you're done? What is the relationship between the level of your physical conditioning to your recovery rate after exercising? So what this is talking about for this question right here, um, physical conditioning is how good of like physical shape you are in. So if you're in really good shape, usually your heart rate will recover really quick after exercising. If you are not in such good shape, it will take a little bit longer for your heart to recover after exercising. And then the last question, do you feel that with daily exercise that you will decrease the amount of time needed to recover? Why? So maybe you think that exercising will help your heart recover. Maybe you think exercising won't help your heart recover. Whichever one you think it is, just make sure you explain why you think that. So that was the introduction section. That's what you did in the previous video. We're going to be moving on to the question for this lab. So question section right now. So the question we're actually asking for this lab, the question we're going to be measuring and planning this lab for, is how long does it take your heart to return to its normal rate after exercise? And then what factors might affect how long the recovery will take? So when I'm talking, we already talked about what it means for your heart to return to its normal rate after exercise. So if you look at this graph right here, we have a graph showing the heart rate. So this is sort of your time before exercise, during exercise, after exercise. And then this is measuring how many beats per minute your heart is beating. So basically we are measuring the amount of time, what is called the recovery time. For this lab. That's the part that we're going to be measuring. And then in terms of factors that might affect how long the recovery will take, it might just be your fitness level. Maybe it matters if you're a male or a female. Maybe your age plays a role in this. Maybe like your height plays a role. We don't know. We're going to be doing some different measurements to find out. So there's nothing you need to do on this slide. So I'm going to continue into background information for this lab. We already talked a little bit about it, but let's get into some more detail. So let's read this together. It says, your heart is continuously beating to keep blood circulating throughout your body. Its rate changes depending on your activity level. It is lower while you are asleep and at rest, and higher while you exercise to supply your muscles with enough freshly oxygenated blood to keep the functioning at a high level. So basically, your heart is pumping to circulate the blood and to circulate the oxygen throughout your body. If you are being more active, your body needs more oxygen. So your heart has to beat faster when your body needs more oxygen. Because your heart is also a muscle, exercise in turn helps keep it healthy. The American Heart Association recommends that a person does exercise that is vigorous enough to raise their heart rate to their target heart rate zone, which is 50% to 85% of their maximum heart rate, which is 220 beats per minute, minus their age for adults, for at least 30 minutes on most days, or about 150 minutes a week in total. Okay, let's pause for a second. That was a lot of information. This is just a recommendation from the American Heart Association. I'm not saying it's right or wrong. It's just some information to give you to help you think about what this recovery time for heart rate is actually talking about. So remember we talked about your resting heart rate. That's how many times your heart beats every single minute. So I'm going to use myself as an example. My resting heart rate is about 60 beats per minute. So this is telling me that I should be exercising or raising my heart rate for 30 minutes on most days, or 150 minutes a week in total. and I should be raising my heart rate to 50% to 85% of my maximum heart rate, which is 220 beats per minute minus my age. So 220, I'm 30 years old. 220 minus 30 would be 190. So that's my maximum heart rate. I'm aiming to raise my heart to 50% of that, or to about 85% of that. So that's going to be anywhere from, what's 190 divided by 2? 45 plus 50 would be 95. So like anywhere from like 95 to probably around 160, 170 beats per minute. I'm just ballparking there. So basically, I can raise my heart to about 50% of that by going for a walk. That would be about, 95 beats per minute. I can, of course, raise it higher by doing other forms of physical activity, but that's what this information is telling me right here. So then it gives an example. So for a 20-year-old, the maximum heart rate would be 200 beats per minute with a target heart rate zone of 100 to 170 beats per minute. For those 19 or younger, target zones can vary more than they do for adults. So basically, all of you are under the age of 19, which means that these numbers might be a little bit off for you. There's a bigger range in children and in teenagers. So you can use this information for yourself, but also know that as a developing person still, these numbers might be a little bit off for you. But this gives you a good ballpark to estimate where you might see your heart rate go. All right, so after exercising, a person's heart needs time to recover or to return to its normal resting heart rate. So that's the recovery time. How long it takes for the heart to resume its resting rate is referred to as heart rate recovery time. In general, people who exercise regularly and therefore are more likely to have healthier hearts have faster heart rate recovery times than people who do not regularly exercise. So again, when I'm reading this and I'm saying regularly exercise, I'm talking about things not necessarily like super intense. This also includes things like going for a walk, doing some yoga, maybe doing some stretching. So this is all forms of activity. I know personally, if I'm going around cleaning my house, that counts as exercise for me because my heart rate gets elevated from doing the cleaning, especially mopping. For whatever reason, mopping gets my heart rate up. Anyway, so after a 100-meter dash, an Olympic sprinter would return to a resting heart rate faster than someone who rarely ever runs. So they're saying that the Olympic sprinter, they practice sprinting, which means they practice increasing their heart rate and then their heart rate can recover. So because they practice this, their body is used to doing this, which means that the recovery time for this Olympic sprinter would be faster than someone who sits on the couch all day, every day. Makes sense, right? The body practices one thing versus not practicing the other thing. So a good gauge to measure how fit our cardiovascular system or our heart is to measure how long it takes our heart rate to recover to its resting heart rate. A recovering heart rate of 25 to 30 beats in 1 minute is a good score, and 50 to 60 beats in 1 minute is considered excellent. So the idea here is if I raise my heart rate to 150 beats per minute, and after I do my exercise 1 minute later, my heart rate comes back down to, I was at 150, so minus 25 would be 125, or minus 30 would be 120. So somewhere between there, that would be a good recovering heart rate time for myself. And then if I want to be like an excellent person, that means that my 150 beat per minute heart rate would have to recover back down to 100 or 90 beats per minute after 1 minute of exercise. That's what this information is saying. So it's giving us a little bit more information of what a resting heart rate is and what are the signs to look for in our recovery heart rate. So if you want to try to figure this out for yourself before actually going through the lab, I have these charts here for you. So this one includes different ages of children and teenagers. And then I guess after, if you're older than 15, just look at the adult one over here. But you can go through and try to figure out what your heart rate might be. And if you look at this chart right here, this already gives you a little bit of a hint in terms of some factors that might affect your resting heart rate, because it splits it between men and women. So wink, wink, nudge, nudge, factor that might affect it, as well as wink, wink, nudge, nudge, the ages make a difference as well. All right, so after we've gone through some of this information, please take a second and answer these questions for background information right here in the chart. So question number 1 says, define the following words: heart rate, resting heart rate, recovery heart rate, and pulse. I believe A, B, and C are all in the background information and introduction for this lab. Pulse, you might have to look up in Google. But basically, your pulse is the way that we measure your heart rate. So you can find your pulse in your neck on your carotid artery. You can find it in your wrist. There we go, in your wrist as well. But you can also look at the definition on Google. And then number 2, what is the job of the circulatory system? To move oxygen throughout the body. Where does gas exchange take place between the respiratory and circulatory system? This is a money question for MCAS. They will be asking you about this somewhere on MCAS. So you need to know that gas exchange takes place between the alveoli in the respiratory system and the capillaries that surround the alveoli of the circulatory system. The oxygen can diffuse from the alveoli into the capillary. Next up, why do our bodies need oxygen? Cellular respiration. We use oxygen to make ATP. And then where does cellular respiration take place? Like which organelle? Hopefully you know what that is, but it is the mitochondria. So you are welcome. Please take a second, answer these questions, and I will see you in the next video for the hypothesis.